In this video, the Breathing Better and Smoking Cessation Club at Dr. Kearney's Cardiology Clinic will debunk 6 myths about smoking and smoking cessation. The first myth we'll debunk is smoking a few cigarettes a day can't be bad for your health. However, in reality, research shows smoking even just a few cigarettes a day can lead to significant health consequences. Light smokers are still at a much greater risk of developing major diseases such as lung cancer, GI cancers, lower respiratory tract infections, cataracts, and more. A recent review and meta-analysis, which pulled results from 55 publications, showed that men smoking 1 cigarette a day had a relative risk for coronary heart disease of 1.74 compared to non-smokers. Women smoking 1 cigarette a day had a relative risk of 1.57. For stroke, the relative risk among men smoking 1 cigarette a day was 1.3 compared to non-smokers and 1.46 for women smoking 1 cigarette a day. Overall, they found that people who smoke around 1 cigarette a day have a risk of developing coronary heart disease and stroke equal to about half of that in people who smoke 20 cigarettes a day. Bottom line is that there is no safe level of smoking. Complete smoking cessation is the only way to significantly reduce the risk of developing 2 major diseases, stroke and coronary heart disease. Another myth is that nicotine replacement therapy, or NRT, is just as harmful as smoking. This is also false. NRT, such as patch, gum, lozenges, inhalers, and sprays, are much safer than smoking. So how do NRTs work? You can refer to our previous videos and webinars on NRTs, but briefly they work by replacing some of the nicotine in your body that it would normally receive from smoking, but it's also released at a much lower level and much more slowly. Additionally, it is important to remember that regular tobacco cigarettes are dangerous due to the many chemicals and toxins in the actual cigarette itself. Therefore, by providing just a stimulant, which is the nicotine, through NRTs, major adverse events are avoided. However, you should still aim to taper off NRTs eventually, as just like any other stimulants like caffeine, it can raise blood pressure. Furthermore, NRTs only deal with the physical dependence. You may still require other forms of support, such as a quit smoking program to help you address the psychological aspects, including emotional and mental aspects of smoking addiction.
Moving on to the next smoking myth, another common one is that smoking helps you relax and relieve stress. In fact, it's actually the opposite that is true. Researchers have found that people who quit smoking felt more relaxed after 1 year's time when compared to people who continued to smoke. Smoking only relieves the temporary craving for nicotine, which is that addictive substance in tobacco, and although it may feel relaxing in the moment, you're really just relieving the tension caused by this craving. Once you quit, it's best to work with your healthcare provider to find healthy alternatives to manage and relieve stress. Another common misconception around smoking is that only regular smoking is dangerous, and that intermittent smoking, or smoking only socially, is harmless. However, studies have shown that smoking occasionally carries nearly the same risk for heart disease as daily smoking does. Researchers followed a group of Finnish men in the late 1900s and found that occasional smokers were 1.5 times more likely to die from heart disease compared to men who did not smoke at all. Each cigarette you smoke hurts your lungs, heart, and the cells throughout your body. Anyone who smokes or inhales tobacco smoke is putting their health at risk, and the best way to prevent this is by avoiding smoking altogether.
So next we'll go over the myth that e-cigarettes or vapes are safe alternatives to smoking. Research suggests that while vaping is harmful, it's still not safe. It still contains nicotine as its primary agent, which is highly addictive, raises your blood pressure, increases your adrenaline, which increases your heart rate and the chance of heart attack. Other chemicals include heavy metals like lead, volatile organic compounds, and cancer-causing agents which are either harmful or potentially harmful. Overall, the long-term effects of the chemicals that make up the vapors in e-cigarettes are not fully understood, but emerging data links them to chronic lung disease, asthma, and cardiovascular disease. It's important to note that e-cigarettes are not currently approved by the FDA as a quit smoking aid. We are still learning about how vaping affects health, and the long-term health impacts of vaping are unknown. However, there is enough evidence to justify efforts to prevent the use of vaping products by youth and non-smokers. The final myth that we'll go over is that it's too late to get the benefits from quitting smoking. This is untrue. Quitting, even later in life, can significantly lower your risk of heart disease, stroke, and cancer over time, and also reduce your risk of death. In your journey to be smoke-free, slipping up does not mean that you're a failure, and you should keep trying and taking the right steps to successfully achieve your goal of being smoke-free. Soon after quitting, you'll notice that your breath smells better, your teeth are getting a bit whiter, food is tasting better, and everyday activities like climbing the stairs might not leave you out of breath as much. Just 20 minutes after quitting, your heart rate and blood pressure will drop, and in just 12 hours, the carbon monoxide levels in your blood drops to normal. In as little as 2 weeks to 3 months, your circulation will also improve and your lung function will increase.
Thank you everyone for listening, and we hope that this video has helped to debunk some of the misconceptions that you've had about smoking cessation and smoking.